The actual name of my specialty is Otolaryngology, so it's easier to say ear, nose, and throat or ENT, but we treat both medically and surgically the diseases of the ears, nose, and throat. So that might involve something as basic as ear tubes for kids or even in adults that have ear pressure problems. We evaluate hearing loss, sinus issues, throat issues, and then of course cancers of the head and neck. And tumors that involve salivary glands or the thyroid. So the greatest thing about ENT is we cover ages of a few months on up to age 100, depending on what problems they have. I think the unique thing that I can offer my patients is I really listen to what they're telling me. I spend most of my time interacting with the patient. I'm not looking at the computer. It's one-on-one, and I really get to the bottom of what their complaints are. The same thing, if I'm in the hospital or I really try to listen to what they're telling me because most of it is the history of what's going on. I know a lot of physicians don't take as much time with their patients, but I spend quite a bit of time with them so they can understand that it's going to be a relaxed environment where they get most of their questions answered at that visit. I first decided I wanted to be a physician after I started volunteering in the emergency room when I was in high school. I started as a volunteer, pushing people around, taking them out to their cars, interacting with them in the emergency room. And at that point I went on to become an orderly, and I worked both in the ER and the operating room. And at that point, I really decided that I liked, the suturing and assisting with people when they're the most vulnerable. And I just felt really comfortable interacting with people. And then the more I got into it, I found that I didn't want to become an ER doc, and I really liked the intricate procedures that ENT offers. So yeah, it started in high school. And then each year thereafter, I kept experiencing different areas of the hospital, and that's when I got comfortable with it. I went to school at Miami of Ohio for undergrad. I studied zoology. I had majored in zoology, and I had a minor in sociology. I then went on to medical school at the University of Health Sciences in Kansas City, Missouri, and that's where I got my osteopathic degree. I then went on to do my internship in Columbus at the Doctors Hospital program, and then my residency was there as well. I really enjoy spending time with my family outside. We like to do a lot of hiking or cycling or mountain biking, and when the weather permits, we try to do as much skiing as we can. But yeah, I love spending time with my family, and usually that involves some sort of sporting event or camping or lots of outdoor activities. I think the biggest misconception is that you have to go to Columbus for major surgeries or major evaluations, when in fact Genesis, with the number of physicians we have, and actually a more personal touch, I believe, than some of these bigger institutions. Sometimes it's a lot easier to get in, get out, get things scheduled. You'll probably have surgery quicker here. But yeah, we try to reassure people that you're getting the exact same care. It's just we may not market as much as some of the other bigger institutions. And certainly a good thing to remember is the physicians here know when it's appropriate to refer to those tertiary centers, but probably 95% of your care you can get right here at home, and it's probably better care, a little more personal touch.